Welcome viewers. My name is Sister Dr. Juliet Wangui Macharia. I am a gynecologist and a fertility educator and medical management doctor, specifically based in Mombasa and also in Voi. I belong to the Sisters of St. Joseph of Mombasa. So welcome to my YouTube channel and please don't forget to subscribe. Today we are going to talk or we start the journey of understanding what the menstrual cycle is. As I had said earlier, that menstrual cycle is day in, day out, life of any woman in this planet. And if you can remember, I said that any woman who do not ovulate is not healthy. So menstrual cycle is actually a series of highly coordinated events that correspond to specific patterns of ovarian activity. So they are highly coordinated events. They are not just simple coordinated, highly coordinated events that correspond to specific patterns of ovarian activities. So anything, when you hear anything about coordination, it's about the brain. So when you talk about the menstrual cycle, these are events that are coordinated from the brain, and then we have the ovaries, ovarian activities, and then from there we are able to see what you call the biomarkers. And the biomarkers, you cannot see it only in the brain or in the ovaries. Most we teach women to see them in a very simple way, but by just checking her vulva. What is in the vulva? Is it blood? Is it a cervical mucus, or is it a discharge? And if it is a vaginal discharge, what is it? Is it a mucus? And if it is a mucus, is it a clear mucus? Is it a kind of candy mucus, kind of a candy discharge? Sometimes you find, is it a whitish? Is it smelly? Does it make you to get some irritation around the vulva or around the vagina? So you don't just get the discharge and then you don't even look at it, or you just say, this is just normal. I'm used. You find a bloody whitish discharge painted at your panty, and you just take it for granted. You do not see the mucus in the mid-cycle for years and years, and for you think you are very okay. Sometimes you get bleeding just for 2 days, and you think it's normal. Sometimes you don't even see the bleeding, you don't see the mucus, and then you are very irritable woman. Sometimes you don't even have, you don't get sleep. When others are sleeping, you are just awake. You don't know what is happening, and then you just take it for granted. That's why we are saying menstrual cycle. It is a highly coordinated. It is a series of events. Remember what I said previously, it is not bleeding only. It is a series of events that specific patterns will be seen in the ovarian activity. So there's something we call ovarian continuum. So when you talk of ovarian continuum, is those changes that happens throughout this woman's life in the ovary. In a simple language, when you start bleeding, for example, and maybe you are around 13, 14 years, we can all recall when we attained our menarche at 12 years, 13 years, 14. And then in between, the bleeding just got lost. We were not bleeding for some years or some months. Then after, the bleeding started again. And we continued seeing our bleeding every month. And all these changes during that bleeding, or when we started seeing our bleeding, we could see we developing, because we had already started developing our breast. Then you see now the breasts are growing. You are now becoming a young, beautiful lady. Yeah? You want to be independent in a way. You become sexually attractive, or say to the opposite sex. Yeah? You start feeling something in the body. And this is science that need to be taught to our young girls. Because women, because we do not understand ourselves. These young girls, when we give birth to them and then they grow, during this adolescent stage, they are just confused. Yes, they have started bleeding. You have given them pads. What else? That is not, giving them pads is not enough. We have to educate these young girls what is happening in their bodies. Because the brain, what we call the hypothalamus pituitary axis, yeah, HPO, it is hypothalamus pituitary ovarian axis, is now maturing at this tender age. And as it is maturing, there are several things, the hormones have been released, which were before they were not released in this manner. They are being released, and then they are working in the ovaries. And then this ovarian activities changes their feelings, changes what they see in their vulva, changes how they feel, changes how they talk, how they look like. If they are students, sometimes they are happy, sometimes they are gloomy. They're just mixed up. So understanding the menstrual cycle is key to each woman. Even if you are at menopause and you are watching my video, please just listen to this knowledge and share it to the young ones, because they do not have anyone to tell them of what is happening in their own body. Continue listening to my YouTube, follow me, and don't forget to subscribe as we learn more about the science behind the menstrual cycle. Thank you, and God bless you.